Over the past 30 years of my career, I have tried to make every effort to explain to the general public about what we do as pathologists. Yes, it has been extremely frustrating, but I've committed not to give up. I think part of the problem is that most pathologists are very reclusive, don't have much to do with people, oftentimes isolated in a cubicle, read slides, go home for the day, and that's it. But I've always recognized that at the end of the day, there's a patient at the end of these slides. There's a family, there's a loved one, there's someone who cried, laughed, and died. Laughed and breathed, had their living, their being. And so there's a person at the end of this. And so I wanted to kind of highlight that this is one of the worst cases of neglect breast cancer I've ever seen in my life. This lady had several masses on her breast, in the right breast, and in the left breast had one single nodule. But no one took the time to examine this lady's breast. No one. She went to one institution, a very popular institution, that diagnosed that she had breast cancer. Had some sort of unknown cancer. Didn't know where the primary was. It's an example that no one took the time to look at her breast. And breast cancer, as I've always mentioned, is one of the most preventative cancer in terms of dying from anyway, because it's easily detectable by breast exam or other, imaging method, way before the breast cancer can be out of hand. So what I wanted to show to you today is I'm going to demonstrate to you just how extensive this breast cancer was. And as we go down the slide, you're going to see breast cancer in the lung, breast cancer around the coronary artery, breast cancer in the heart muscle, breast cancer in the liver, breast cancer around the pancreas, breast cancer around the spleen, breast cancer in the brain, breast cancer in the cerebellum, breast cancer in the adrenal gland, breast cancer in kidney, breast cancer in the gallbladder. And then finally, because I want this to be the highlight of the discussion, I will save this last slide to show you, what normal breast looks like versus when it becomes cancerous. And even in this particular breast tissue sample, this is from one of the masses in the breast. You can actually see where breast cancer is in lymphatic or vascular channels. So let's get started with the presentation. So I'll begin by starting with this lung section. This is relatively normal looking lung tissue. And I think the tumor will pop up as you will see it. This is very normal looking lung tissue, some congestion, but you'll start seeing some tumor. There is a focus of tumor in a blood vessel there. And we'll go and highlight on a closer view. There's more tumor in the velar space. You see more and more tumor. This is all metastatic breast cancer in the lung. And we'll go and take a look at the detailed features as we continue to peruse around. But you can see there is extensive cancer involving this lung, metastatic cancer involving this lung. Again, this is relatively normal lung there, and you got tumor right adjacent to it, even filling up alveolar spaces there. That's all metastatic cancer. And you see a little tumor necrosis with it as well, as the tumor outgrows its vascular supply. So we're going to keep on going around, and then let me just go on and highlight what this tumor looks like under closer observation. You can see that the tumor cells are extremely wild, bizarre, very anaplastic in their growth pattern. Let me see if I can go. Yeah, we can go even closer so you can see what I'm talking about. These are monstrous looking tumor cells. See the nuclei there? That's cancer cells from breast. Very aggressive looking cancer cells. And a lot of these tumor cells, once they get to be so pleomorphic and undeveloped, they can look like just about any other kind of cancer, but we know that this tumor originated from the breast, and we'll show you how we know that once we get further into the observation here. All right, let's go to the next slide. So this is metastatic cancer in the lung. So we're looking at a coronary artery here, and as I continue to peruse around into the soft tissue of the pericardial arterial tissue, the heart coronary artery tissue, you'll see there's tumor and lymphatics, extensively involving lymphatics, and then the fibroadipose tissue around the coronary artery. Extensive tumor there. That's metastatic tumor around the coronary artery. Here's a section of myocardium, one of the ventricular myocardium. I think this was a ventricular myocardium. It could have been the right, but I think this is the left ventricular myocardium. And right there in the middle, you're going to see tumor right there in the middle of the heart muscle. You have to wonder how this heart was beating. So you see all metastatic tumor within the heart muscle itself. That's the myocardium, and there's a metastatic tumor within the myocardium, even with lakes of necrosis and inflammatory detritus right there in the heart. And this person was still walking and talking with this tumor in her heart. All right, we're going to go to the next slide. We're showing liver here. That's liver tissue there. And right there, you're going to see all metastatic cancer within the liver. There's, again, more lakes of hemorrhage and necrosis from the tumor itself as it outgrows its blood supply. But let me keep on perusing around this liver. You'll see how extensive that this liver is involved. This is relatively normal liver there. It's a little congested, obstructed. And then you see more tumor there in the middle. Extensive tumor here involving this liver. Okay. All metastatic tumor in the liver. We are seeing the pancreas here. That's a relatively normal pancreas there. And right adjacent to this pancreas is metastatic cancer, even with more tumor necrosis and hemorrhage. But you can see that this is relatively normal pancreas here, and the tumor is right there, metastatic cancer from breast involving the pancreas. As we continue to peruse around. Extensive cancer. And it's amazing, the person towards the end of life simply presented because she was bleeding. Went to the hospital, and they knew that she was terminal, and allowed her to bleed to death because there wasn't a lot that could be done after that. Here's an example of spleen. That's relatively normal spleen there. You can see little lakes of tumor within vascular channels of the spleen. And as we continue to peruse around, you're going to see actually tumor right there. That's tumor right there with necrosis and necrotic debris, all involved in the spleen there. That's all tumor right there in the spleen. There's the capsule of the spleen, and you can see tumor right there along this capsule. Alrighty, that's more tumor. Let me see if I can go down just to kind of convince to you that this is not make-believe, but real cancer. That's all cancer involved in the spleen. Metastatic breast cancer. Here are sections of brain. You can see little foci of cancer there, but I think we had some larger foci focus, like here. There's more breast cancer there around the vascular channel. So that's metastatic. When you see vessel cancer pooling around blood vessels, that's a sign of metastasis. All right. As we continue to peruse around, this is a relatively normal brain here, but she indeed had cancer as well. There's more little lakes of cancer right there. More cancer there around the vessels and stuff. Metastatic cancer, extensive cancer. This is all for breast primary. Went undetected for many, many months. Here's more tumor involving the brain. Well, actually, this is okay brain here, but as I continue to peruse around, and we'll get to that point where we're going to see some tumor even in this. Let me see. I think, let me see. Let's go over here. Okay, you will start seeing some tumor here, and I'm just going to zoom out so we can see where we are in the gestalt of it all. All right, so that's still tumor there. And here you go. There's a landmark. So cerebellum, and right there next to the cerebellum, you see metastatic tumor. And if we go down, just so you can see the features of the tumor up close, that's all metastatic cancer right there. If I go down one more to see if we can. Yep, you can see very bizarre, ugly, mean-looking cells. Very aggressive breast cancer cells is what those are. Alrighty. Now we're going to go to another slide. So you immediately recognize the adrenal gland. That's relatively normal adrenal gland there. And right there, you see tumor in the adrenal gland, metastatic cancer in the adrenal gland. That's all metastasis from the breast, primary breast cancer, metastasized to the adrenal gland. Still see more hemorrhage and necrosis there. And then there's some residual adrenal gland tissue there. Okay, so let's go to the next slide. So now we're viewing the kidney, and as we continue, you see a couple of glomeruli there in the center there. And then as we continue to go around, you see the renal tubules, and right there, you're going to see metastatic cancer from breast involving the kidneys. And again, you see that the same gestalt with the very pleomorphic, bizarre looking cells. This is all from breast cancer, very angry looking cells. All from breast primary. All right, this is the cancer cells up close. All right, let's go to the next slide. That's metastatic breast cancer involving the kidney. So recognizing normal histology, that's relatively normal gallbladder tissue, but as we peruse around into the wall, you can see metastatic cancer in that gallbladder wall. So that's from breast primary, again, with hemorrhage and necrosis around the tumor itself, metastatic tumor focus. And you see it extensively involving vascular channels there. Okay, now we're going to go to the next slide. Now, finally, this is from breast tissue. I want to show you what normal breast will look like. Well, this is relatively normal breast. There are little fibrocystic changes involved in this breast here, but this is not cancerous breast. And we'll show you the transition between what normal looking breasts look like with a little sclerosing adenosis and fibrosis. It's all fibrocystic stuff, but there's no cancer in it. So I'm going to go down just so you can kind of take a look at what the cells look like that are not cancerous cells of the breast yet. Okay, very normal looking breast ducts. They have 2-cell population around those ducts and lobules. As we go around, a little scar tissue there. And then you can see some microcalcification right there in the center. You see some benign microcalcification. So as we continue to peruse around, this is our relatively normal looking breast tissue here. Relatively normal looking breast tissue. And I think the light bulb will go off once you see what cancer of the breast will look like. As we continue, this is just normal vascular tissue within the breast. As we continue to peruse around, this is what we do as pathologists. We look at the normal tissue and compare it to abnormal structures. Now we get into the breast cancer itself. So this is cancer within the breast. This is a primary breast cancer. Oftentimes we know it's primary when we see DCIS or LIS and like in situ cancer. In this case, the cancer is really progressive and pervasive. And it's not much. There were a few areas of DCIS, but most of it was very aggressive, infiltrating mammary carcinoma. And we have previously shown up close. And as I continue to peruse around, you can see that this is extensive cancer. And look at it right there in a lymphatic channel. That's in a lymphatic tumor floating in lymphatics. And then you can see the tumor is very infiltrating in fibrodesmoplastic connective tissue, inflamed tissue, and so forth and so on. And as we continue to peruse around, this is all breast cancer here. That's a little necrotic and hemorrhagic focus of the tumor. As we continue to peruse around, all right, you can see a little residual breast ducts. And that's here. This is beautiful. This is what I wanted to show. That's benign calcification. That's why we ask you to get your mammogram, so that the doctor can look for those calcifications right there. That little blob of purple material right there in the center. That's benign. Before these ducts become cancerous, sometimes they'll have calcifications in them to let the radiologist know that, hey, we need to study this closer to make sure there is no cancer floating around. And right next to the benign calcifications, you see actually invasive cancer. So this is a great transition of why we do what we do. I've been stressing this for over 30 years, that we got to focus on preventative care, not waiting until you're sick, because oftentimes it's too late. So please listen to me, take heed that some of this is still benign breast tissue right here, right next to invasive cancer right there. So we got to do better, particularly with breast. There's some more benign breast tissue right adjacent to infiltrating malignant breast cancer. Okay? We got to do a better job with getting people to realize it. And I'm going to correlate this with, I'm going to show you now the clinical image showing the breast cancer disrupting the skin of the breast, and that no one ever took time to examine this lady's breast. So we're palpating the breast now. Here's the right breast, and there are several lumps like here, and let me see, actually it's diffuse in the breast. So I presume that's maybe a little breast cancer there. There's a lump here. It's probably a swollen lymph node. It's just quite sizable there. The primary of this cancer, this person did have cancer, but the primary was unknown, and until later in the disease, and then they said it was breast primary, but obviously someone missed the ball on this one because there's a palpable breast mass in this right breast. The other breast didn't have that much in the way of palpable lumps. There was a couple of small ones, but I didn't see any large one. But this one is clearly lumpy breast tissue right here. So I presume I'm going to take a sample of that to make sure that what my impression is. But if you can see, if I can kind of cover the nipple and show you, that's at least about 5 centimeters on that lump, and probably another 3 to 4 centimeters on this lump right here. So both lumps next to each other, suspicious for metastatic breast cancer.